All right, welcome everyone. Really excited to continue our policy skills series. As many of you know, I'm Beth Griffiths, and along with Janet Kaufman, we serve in the role of Associate Directors of Policy Programs here at the Institute for Health Policy Studies. And we're really thrilled to have you all with us today, particularly after the day after Election Day, and really talking about how do you develop and then maintain, sustain your policy long game. As many of us know, of course, policy change doesn't always happen quickly. It is obviously a process full of ups and downs, and we have three incredible folks who are joining us today. Really grateful and honored to have them joining us to really join us in an interactive conversation, a roundtable. So feel free, I'll be asking some of the initial questions, but feel free to jump in into the Q&A or the chat, and I'll intersperse your questions, and then we'll save some time for them at the end. As those of you who've been here before know, most of our presentations up until now have had sort of a single guest giving more of a PowerPoint style presentation, but we really felt that for this topic, there's not one way to answer the question of how do you develop and maintain your policy long game. That we would really benefit from a conversation from a variety of different experts. And so I'm going to begin with some brief introductions. We are just getting some tech issues settled here for a minute. So I'm going to begin with some introductions, and then we're going to hopefully have all of our panelists on with us very soon. I'll just begin by introducing Patty Barahona, who is currently Chief Executive Officer of the Youth Leadership Institute, which is an organization that builds communities where young people and their adult allies come together to create positive community change. Next, I'll introduce Tracy Woodruff, who is professor at UCSF and a leading scientist who's produced seminal research on how harmful chemicals and pollutants impact health, pregnancy, and child development, and also was previously a senior scientist and policy advisor at the US EPA. And then last but not least, I'd like to introduce Anthony Wright, who is Executive Director of Health Access, has been in that role since 2002. Health Access is a statewide healthcare consumer advocacy coalition that has really been involved in helping to pass the Affordable Care Act and other state laws to help implement it, as well as a number of other things. But really, I want to begin by letting each of them talk about their work a little bit, and then we'll really delve into the conversation of developing and maintaining your policy long game. So I'm going to begin with just having each of you talk a little bit about the work you do. And then I know none of you do this work alone. So how you sort of have worked in coalitions with others to further the work that you do. And I'll start with you, Patty. And if at any point any of our panelists feel like jumping off on a point, feel free to jump in. The goal is really to have this be interactive. So I'll come to you first, Patty. Thanks so much again for being with us.
Well, thank you so much, Beth, for having us. And it's really lovely to be joining you, Anthony and Tracy, in the space together. My name is Patty Barahona. I use they, them, she, her pronouns. Youth Leadership Institute is a really special place where young people get to be at decision-making tables across the state of California. And that really looks like young people developing their leadership skills, using research as a method to create and both frame and the problem and also the solution to change, to tell the stories of their communities and to actually move the needle on policy change, both at the local and countywide level. So that's the work that we get to do every single day. We're in the Central Valley, in the Bay Area, and in Southern California. And so we sort of use a community-based institute model to do that work on the ground, take a lot of those learnings and do some consulting across the country. We don't do this work alone. I think young people are obviously a focal point and at the center of change in the process, but many of us, know that we can't create policy change without having coalition partners together at the table, really informing the change. We know that one policy change informs and supports multiple communities. And so when we're building out our campaigns, a lot of what we're doing is trying to analyze in what ways can others be a part of this solution, and at what ways is this inequity impacting other health outcomes from other communities. and how do we bring those folks to the fold and work in partnership and in lockstep as we put some pressure on our policymakers to create change. So I'll say that. I'll pass it back to you, Beth.
Great. And then I'll come to you next, Tracy. Would love to hear a little bit about the work you do, and then how you work in coalition with others in that work.
Great, thank you. And yes, it's really great to be here with these other luminaries on this panel. So my name is Tracy, and I am a professor at UCSF. And as Beth said, before that, I worked at the U.S. Environmental Protection Agency. So I have a lot of experience about how regulatory agencies make decisions and how influential they are. Because even though once laws pass, there's a lot of things in laws that are left up to the discretion of regulatory agencies. So for us, it's really important that those regulatory agencies make the best decisions that reflect science and their mission, which is, in the case of EPA, to protect the public's health. And that doesn't always happen. And a lot of it is because we don't have really great engagement by a lot of the NGO community, because regulatory agencies are very obtuse and obscure, and people don't really understand all the components that go into decision making. So I run the program Reproductive Health and the Environment and the Environmental Research and Translation for Health, or EARTH Center at UCSF. And our goal is to create that bridge between science and actionable change that results in systemic changes. That's why we focus on public policy, because to really benefit everybody in the population, you have to make changes at the system level, which will in result have downstream influences on everybody's health. And we have three components to our program. So we do research, but our research is very focused on answering questions that are critical for policy makers so that they can make better decisions. And our overall goal, the mission of our program, is to create healthier environments and healthier populations by reducing the environmental burden on populations and how it's inequitably distributed among different populations. So environmental injustices. And one of the advantages of being at UCSF is it's a premier science institution. One of the disadvantages is, I would say, that there's not as much appreciation in the medical field about the role of environmental contributions to health and health inequities. And so that's one of our goals, is to how do we make the science understandable to our partners who have a lot of, I mean, to be frank, we work with people who have a lot of power. So the clinical community has a lot of power to be influential on people's health. So we work with them to bring information to them so that they can speak out on behalf of their patients and the public. So that's our second kind of aim, is to get the clinical community engaged, to be advocates for systems change, to improve health on behalf of their patients. And we focused on really in the area of reproduction, but pregnancy and development, because that's really critical in terms of setting the life course for people. So during the fetal period and childhood, those influences, whether they're chemical exposures or social stressors, can influence people's health throughout their life course. So and if you make decisions that protect the most vulnerable, whether it's by race, ethnicity, SES, or life stage, your policy solutions will benefit everybody. So then the third piece we do direct engagement. How do you use science? And when regulatory agencies are making specific decisions, and we focus on, and we don't work, so we work in partnership, we organize scientists, we work with scientists across the US, globally. We also work with scientists in federal agencies, and then we work with the NGO community. So communities that are actively, or NGOs that are actively engaged in policy engagement, whether it's like Earth Justice or NRDC, or we work with umbrella groups that represent environmental justice advocates. So Coming Clean is another group that we work with. And our goal is to provide them technical assistance, because they need science to do their advocacy or legal work. And where our goal is to provide that to them so that they can be most effective.
Wonderful. Lots to follow up on there, but I'm first going to come to Anthony just to talk a little bit about your work. And obviously I know you have a ton of experience in coalition building and what is successful there.
Yeah, so great to be here. Again, my name is Anthony Wright. I'm the Executive Director of Health Access California, which is a statewide healthcare consumer advocacy coalition. working for 35 years on the goal of quality, affordable healthcare for all. We are first and foremost a coalition organization. So our board is 25 organizations that represent everybody from the California Black Health Network to the Congress of California Seniors to the California Labor Federation to the Children Now, like just the range of organizations of people who care about healthcare, which is everybody. And so I would say that we have a staff of folks that are lobbyists. Our office is across the street from the state capitol, and we do work at some of those obscure administrative agencies that Tracy was talking about. We have a staff of organizers around the state. We have people who work in communications and other realms. But if it was just the couple of handfuls of us, we wouldn't have the power. The power comes from being in coalition with organizations that in turn also represent hundreds, thousands, millions of people. And so I see our mission as twofold. One is, how do we achieve meaningful improvements in people's lives, especially as they deal with the healthcare system, whether it's dealing with surprise medical bills, prescription drug prices, the ability to get on Medi-Cal, the ability not to get denied for service from a health insurer, those kinds of efforts to expand coverage, to secure coverage, to help people with the bill afterwards, but also just co-equal with those tangible improvement in people's lives is how do we engage people and organizations in the policy and political process so that they can be effective on behalf of themselves and their constituency. So what are the campaigns what's the legislation that we can write that folks can advance that helps them? What is the fact sheet or the timely information that's going on in the legislature that will help them engage in a meaningful way? What is the campaigns that they can plug into? And so that is co-equal to our effort, is how do we engage individuals and also frankly organizations, so that if they're going to spend literally 5x% of their time on health and health advocacy and health policy, that they're doing it as effectively as possible for their constituency. So that's how I see their roles, and we'll talk about some examples as we talk about. But in the scheme of the Sacramento, there are groups that represent doctors and hospitals and insurers and drug companies. We're the coalition umbrella group that tries to represent patients and the public, and that's our role in this in this sphere. So happy to talk more.
Yeah, wonderful. Such incredible work that all three of you are doing, and I want to open up to the whole group to really follow up on examples or particular times when you feel like you've been part of a successful coalition and what you think the keys to that success were. Maybe I'll come to Anthony first and then to Patty, if that's okay.
Yeah, I think overall, we are interested about a term that I like to use is one of targeted universalism, where every because we work with a lot of groups that are very perhaps specific constituencies with specific needs. And at one level, whether it's an immigrant rights group, whether it's a group focused on LGBTQ or gender affirming care, or the MS Society with regard to that, or other types of patient groups. And there are some issues that they need to work together in coalition on to have a more universal solution that really deals at a fundamental systemic issue problem that you really need to change the system in order to get something done. You could ask, if you were part of the MS Society, you could ask for something specific for MS patients, but really it will work. The whole thing would work better if you're in a universal system, right? If you're in a system that helps everybody. At the same time, on the flip side, you could also just be for those universal solutions, but you have to be mindful that that you need to also recognize that different groups and different communities are going to need different and specific solutions to deal with their issues specifically, whether it's because of structural racism, whether it's because of income issues, whether it's because of immigration exclusions, whether it's because of just the whole host of issues. And so you have to do both. You have to sort of both have a way to sort of deal with sort of the forces of the universe broadly, but also how do you respond? But your work is not done if you do that. You also have to say, how do we actually resolve, this racial or ethnic health disparity that exists, or how do you make sure that if you're having a solution that it actually works for the most vulnerable, or even the folks that just might have different, whether it's, access for people with disabilities, or whether it's language access, or 5 other things. And so that's a really important part of coalition building, is recognizing the sort of the commonality of where there is common cause, as well as recognizing how we can be supportive of one another's efforts to try to get to, the truly universal, affordable, equitable health system. I'm happy to talk more about specifics, but that's just an overall thought.
Yeah. So
Yeah.
important, the importance of the universal, and also the particular expertise of each of the different coalition members.
Well, I think it's like, I wanted to follow up on that because, I'm actually I'd be interested in your opinion, but, we have the aspirational goal versus the reality of having incremental change. Seems like healthcare is a good example of that. But I mean, in our field, in the work that we've done, we do a lot of work focused on national policy, that we do also engagement with some work in California. And one area that we've been engaged in is there's the laws that govern how chemicals. So you think about chemicals, like you pick up your shampoo and there's chemicals in your shampoo, or you think about stuff in your carpet or whatever. There's thousands of chemicals that are used in the marketplace, and they're mostly unregulated. Like manufacturers you go to the store and nobody knows whether the chemicals are used in that product are safe or not, which most people don't know. And there's a law federally that governs the management of those chemicals. And so there was been a lot of efforts on behalf of the NGO and community groups over a number of years to change that law that was passed in the 1970s. It was regarded as very ineffective. And we were engaged with them by providing some of the science policy principles advice about, well, if you change this law, what are some of the things that you should have in this law? For example, everybody who makes a chemical should be required to tell you whether it's safe or not before it's used in a product, right? And then they should tell you where it's being used, et cetera. And so there was I think one thing that's important about this, maybe you guys have experience with too, the funder community is very important in this whole, because a lot of the NGOs or community groups are funded by foundations or by, some of them are membership organizations, right? Like your NRDC or something like that. So there was a decision by the funders in collaboration with the NGOs to focus on a specific strategy to try and get a change in the law nationally, which is called the Toxic Substances Control Act, get it changed so that it would be more reflect modern what we should be doing about, the chemicals should be tested and identified, and then they should be taken out of or reduced in the marketplace if they're found to be harmful. A good example is asbestos. Everyone knows asbestos is a carcinogen and has yet not been regulated by EPA. So they were successful in passing the. So they got things to the table in DC, but then the law passed, and a lot of things were changed at the last minute that ended up making the law not as strong as it could be. So I think it's similar with healthcare, right? You have something happen, it's a pretty good success, but there's still a lot of work left to be done. Yeah. So, and then in the next thing that comes is implementation, right? So you have a law, the laws don't change very often, So you have to spend a lot of time on the implementation, and that is a lot of direct engagement with federal agencies. It's public comment process, it's working in coalition to like make sure that they're listening to the public, the scientists and the health community, because you can be assured, I'm sure it's the same in healthcare, that the people who have money at stake in the process, whether it's the healthcare industry or the chemical industry, they are there all the time at the regulatory agencies telling them how they want to see something happen. So it's really super important for us as scientists and public health promoters to be engaged in the process, but you have to have a way to link in, because it's very hard to do it as an individual,
Right.
almost impossible. So
Yeah. Agreed. Impossible to do it as an individual, or almost impossible unless you're incredibly powerful. And so we'll certainly come back to that piece around incremental versus sort of more aspirational change, because I definitely want to get there. But first, I want to see, Patty, if you have anything else that you want to add in terms of the examples of successful coalition building. So I know you've done a lot in that space.
Yeah, definitely. I would say a couple of different things. One is that we spent about 6 years on a policy campaign with young people in San Francisco, 3 cohorts of young people. Some of that had gone already on to college. And we were able to pass one of the most comprehensive tobacco retail density ordinances in the country. And that really came out of young people experiencing asthma at really high alarming rates. And when we pulled apart the research, and young people took a look at where are these actual tobacco licenses in our county, in our city and county of San Francisco, and noticed that they are most concentrated where most communities of color live. This is not a coincidence. This is by design, by an industry that seeks to harm communities of color every single day. And when we looked at the retail licenses in the Mission in comparison to the Marina, it was really clear that there was a big inequity. And what we did with that was research it in multiple directions. We had to talk to supervisors year after year after year, and got so close every single time, but could not get the political will to change this, because it was very controversial for merchants, for local small mom and pop shops that are selling tobacco, amongst other things, where the city really cares about our small businesses. This would, in effect, from electeds' eyes, would impact these small mom and pop businesses. And so we had to figure out how do we make an economic stand on this, in terms of figuring out how much money they're actually going to lose, how much we are actually losing as a community when we think about the harms and all the negative health outcomes that folks of color were experiencing, particularly in specific districts. So we were able to level the playing field and cap the number of licenses per district, per supervisorial district, to only 45. And those that were at 100, 110 cannot issue another license until they get under that 45 cap. And I'd say that the most important thing about that was that you had to continuously build relationships with the Board of Supervisors. At the time, we had young people sort of coming with the map, like this isn't right. And here's the overlay of the health outcomes. Here's the overlay of the cost to the health system. Here's the overlay of what this means for us. And we do need an answer for merchants. We do want them selling healthier products, and how can we support them to do that? So we had to work with Merchants Association. And the one last thing I'll say about that is that as we were talking to Board of Supervisors, we had our maps, and we decided to cut out a picture of each one of them and put it on the map, and put smiley faces next to those supervisors that supported us. And we went to each supervisor's office, and we arrived at the time at Supervisor Avalos's office, and he immediately saw this and said, well, why don't I have a smiley face next to my picture? I'm not sure what's happening here. And we said, well, actually, we came to get your support today. And it was a perfect entry point to say, other folks are supporting this, support us in doing this. And Supervisor Eric Marr at the time championed it forward. So really took a long time, a lot of years, and a lot of political will.
Wow. What a cool story. That's definitely a visual that will stay with me. I want to turn now maybe to talking a little bit more about the impact of research on policy. So many of our audience members, either are involved in research or collaborate with researchers, conduct research themselves. And I know that you all have different vantage points on this. Some of you having really conducted the primary research, others of you, using it to impact policy change. But would love to hear what advice you would offer to researchers who really want their research to have an impact on policy. And I'll start with Tracy, and then I'll come to Anthony and Patty.
Yeah, so I have a couple thoughts about this. Sometimes, and this happens a lot in our field, maybe in your field too. Actually, when you were talking about that story about tobacco, it's like, well, people will say, we need more research, but that's really code for somebody does not like the decision you're about to make. So that's the reality that, when I was at EPA, but I started in the Clinton administration, that there's so much pressure from the industry about decisions that were being made that the EPA kind of backed up and said, well, we only make our decisions based on sound science. But I think the first thing you have to realize is science is only one part of a decision-making process, right? There's science, there's how people feel about it, who's paying the costs and benefits. I mean, the whole thing with the small merchants is like, who was paying the cost for selling tobacco? And it was the community, not the tobacco industry. They were getting the benefits, right? So I think one thing that we are very focused on is being clear about what the science says and what are the values, all the other aspects go into decision making, and to try and be clear about when do you have enough information to make a decision. I mean, obviously that's very, because a lot of, and so that's one piece. The other is, what is the kind of scientific information that you need to move an issue? So something for us that was that's been very impactful is, and this is something I did early on at UCSF, is people just, the thing that we work on is chemicals, right? Chemicals and products, and they're invisible. Nobody knows they're there. You can't see them, but we can measure them. And so one thing that we did was, well, how do we show that these chemicals are actually in people and that's going to be a problem? So we took available data, and I think somebody said something about fact sheet. I think it was the other thing about fact sheets. And we just aggregated the available data from the federal government and pulled it together and showed that pregnant women were exposed to at least 43 different toxic chemicals at the same time. Like, this was unknown at the time. It was knowable if you knew where to dig and find all the data. But having that kind of factoid that's based on rigorous data that's collected by the federal government that we could then use to talk with the American Congress of Obstetricians and Gynecologists or talk to EPA, it just changes the nature of the conversation, because it makes something tangible that before was not tangible. And that's the third thing is, and this is a big challenge for scientists, is that you have to speak in extremely plain language to policymakers. And of course, we have lots of caveats, and we don't want to be wrong and all those kinds of things, but it is important. You can speak very clearly about what your findings are while still acknowledging there's uncertainty in the evidence, because it's okay to have uncertainty. People make decisions on uncertainty all the time, right? Think about going to the airport. You don't know exactly what's going to happen to your plane, but you make a decision about when you're going to go to the airport, right? So that's what I mean. People are very, but I think we get kind of wrapped up in not being wrong, but it's okay to be, to talk about the evidentiary basis while also explaining, who's going to benefit, who's not going to benefit, and the consequences of the decision. So, and I guess for us, when we pick a research topic, we don't pick something that people are working on. Sounds very like there's a lot of research showing that air pollution is bad for you. There's a lot of research showing tobacco smoke is bad for you. So in my opinion, my value add in terms of research is not doing more research on that, but making that research more actionable. Our value add is talking about chemicals like you probably haven't even heard of, but they're toxic, like siloxanes and quox and things that are used in cleaning products that people are exposed to. And that's where we figure out is how do we move the needle a little bit more on the fact that there's these chemicals and these products that we need to deal with that can engage with the public.
Mm-hmm. Thank you. Yeah, so insightful. I want to come now to Anthony to talk about sort of your experience of maybe collaborating with researchers or
Yeah.
using research to impact policy, and sort of what advice you would give to researchers who want to be in that space.
I mean, I think two things I want to impress upon is the need for communication and for timing. On communication, just, I do think that there's lots of research questions out there, but for those of us but to have communication with the advocates in the field, to have the communication with the community, the impacted community is really important at both the design level and the front end, and then also in the sort of distribution and the crafting of how it is distributed in the back end, right? There are questions that, and some of it's just about, so it's not necessarily about good or bad, it's also just about relevance, right? If the folks who are the advocates in the community can tell you, it's good and well to sort of talk about this issue broadly, but this is the debate that's going to be debated in the next year or two, that if you want to have an impact, these are the questions that would be the most helpful, right? In healthcare, we can talk about the benefits of the universal system, the benefits of healthcare, the issues, whatever, but here are the specific issues that are actually in question live, that policymakers will be chewing on, in this next year, 2 years, 3 years, and I think that would be very helpful. And then on the back end, I do think timing matters. That I appreciate that in academic time, sometimes something gets deadline gets delayed, something gets moved on, but in the legislature, we have a state constitution that has very specific times about when a bill is up in committee, when a bill has a floor vote, when a bill goes to the governor, when the governor has to sign it, and those are not movable. So a study that comes out in March on a relevant bill is a lot more relevant and a lot more impactful than one that comes out maybe even several weeks later or several months later, because of the timing of how it impacts, say, in the state legislature. And obviously it's different if it's a county supervisors or whatever, but you get the point. So I do think that you want to be relevant to the conversation that is going. Now, obviously, there are times where research is really important to expand the conversation, to push the limits of the possible. And that's what both, I think, research and advocates try to share, is how do you actually push against the politics of the possible. But there's a difference between being in left field and being out of the stadium, and just trying to figure out what that balance is. So those are some just initial thoughts. I mean, obviously, we've benefited really usefully in working with academics so that they know what we're doing, and that we can inform them about what's going on in the Capitol, what are the conversations, and we benefit from them about the research they're doing and how we can feed that into, whether it is, one example is just how, the increasing research about how consolidation in healthcare systems is actually one of the major drivers of increased costs. And it's one thing to say it and you might intuitively know it, but it's a lot more powerful to say, no, actually rates in Northern California are literally, 20, 30, 50% higher than in Los Angeles because of consolidated markets. Like that's a really useful thing. And there's a lot of examples like that I could continue going, but that gives an example.
Yeah, I just wanted to say too, one thing that we did, I don't want to follow up on that timing. So back in the Trump administration, I think one of the things that we try and learn from the people that are, I will say in that case, that were our adversaries who are anti-science, we learned was when the Trump administration came in, they had been working with these think tanks to come up with like a very clear plan about the exact things they were going to do to make changes at EPA that would benefit the regulated community. And it was very clear. It was written by the Competitive Enterprise Institute. And it was 10 things. They were going to get rid of this. They were going to do this. And they came in and they did those things. Like they started, I mean, they didn't do them very well. They got sued and were stopped. But I think what we did was we learned from that, and we actually in a 2 year, like a year and a half before the 2020 election, we basically got together a coalition of scientists to come up with, well, what would be our priorities? Should there be a change in the administration? And in the kind of a similar, like, what are the changes we want to see happen, and how EPA uses science in their decision making that would be of benefit, right, to the public's health rather than to the regulated community. And so there's like a couple ways. So like joining those types of activities, and actually when we came up, we wrote them very clearly. We met with the transition team. We did see some of them implemented. And so, and then we follow up with papers that, because it is important. I agree with you about timing, and it's also important to have papers in the peer reviewed literature that then support these changes that are coming, because there's a long game that's going on in the policy process as well. And you want to kind of shore up what's happening and to build up into the future.
Yeah, so such an interesting point about, I think things I heard were obviously the timing is so important, often like quickly almost as there's a change, if I'm hearing you right, Tracy, like sort of being
Well, but
ready.
you should be anticipating too, because like you're saying, when the legislative cycle is in California, you can we didn't do anything for this election, but you could see, like, if the Republicans take over the House, which they will, right? There's going to be a series of things that they're going to do that are going to be impactful on these federal agencies. They're going to be having hearings. They're going to be sending letters. So, doing what we can in anticipation of this to shore up what we see will be a push on how
Right.
way science is going to be used. I think it's important to be kind of looking down the road.
Yeah, looking down there. Anything you want to add, Patty?
Yeah, no, I mean, I think all of that is incredibly helpful, and thank you all for sharing. I think from our perspective, we feel like those closest to inequity are closest to the solution. And so I think if you want your research to impact policy, and you're working with community, which is at the center of that change, that you have to be humble. And I know that I don't know, I think there's really important a sense of humility to enter these spaces where this is folks' lived experience, and how much your lived experience matters in that as well. Because I think, that policy change, that tobacco policy change came out of taking the research and putting a qualitative story of a young person's life, and the impact of that tobacco, that harm in their lives, and how that really, I think that actually transformed what was happening in the room with the particular supervisor, Eric Marr, that decided to champion this issue. So I would say that's one thing I would say. The other is that you got to build small steps. I think any policy that changes started with, for us, we go to the Youth Commission and get a resolution passed. We go to the Public Health Commission and get a resolution passed. We use that research that you're working on to help sort of start to build the narrative and the frame for what we're trying to do, so that when the timing is perfect, we sort of can enter really good opportunities to change policy. And the last I'll say is, small is all. Adrienne Maree Brown talks a lot about emergence in her book, Emergent Strategy, about small is all, and really thinking about what's the small impact that you could have with your research, like joining a nonprofit board. Bring that research to key issues that you care about, and join the nonprofit community who's looking for that work to be able to continue to drive their mission and vision forward.
Yeah, beautiful. I am just going to remind the audience to go ahead and put questions in the Q&A if you want to. We're going to be headed to that relatively soon. But before we do that, I want to come back to a thread that has come up a couple of times, which is sort of this tension between the long-term transformational change that we oftentimes know is needed, and then sort of the incremental change that may be possible in the moment, and how that can sort of build over time. And would love to hear each of your reflections on that. And then also maybe even more at a personal level. I know that oftentimes policy change can have many setbacks, and you can get many no's before you get to a yes, and how you sustain yourself in this work. So I'm going to come to Anthony, and then Patty, and then Tracy.
Yeah, I mean, I am gratified that I have been doing this work for 20 years in this current role, and during that time, we've had the transformational change of the Affordable Care Act and everything that brought, but that was both remarkable and a moment of a lot of things coming together that obviously a century of efforts at health reform, where then people had multiple efforts of trying to do health reform, and folks learned from each iteration, whether it was efforts during the Roosevelt, Kennedy, Clinton, and to when there was another window of opportunity in the with a new President Obama and new majorities in the House and the Senate to do something. But that was something where there's been a lot of literature about how that took a lot of alignment of both research, of figuring out what was policy designs that made sense for. So in the interim between sort of the Clinton effort and the Obama effort for health reform, there was a ton of work that went on that was coalitional, that was research, that was effort to try to figure out, okay, what made sense for that next window of opportunity. And so I think recognizing that, and it's not like that's the only thing we did. Like, there was a range of efforts to try to prime the issue, to try to make advances, to try to highlight the problem of whether it's people being denied for pre-existing conditions, whether it's people who were excluded from coverage because of affordability, whether it was HMO patients' Bill of Rights, and trying to address some of those concerns. So there was both the specific elements that were sort of focused on, as well as hoping that you were being hopefully articulate, that you were trying to go for a broader vision, and trying to tie that with just political momentum, that success begets success. And if you could build that and build trust and build community and build policy infrastructure, that you can build upon it. Now, obviously, the Affordable Care Act was both huge and also insufficient. There's a ton more we want to do. And so that in itself was an incremental reform, but but the victory allowed us now to have a foundation that now we can build on for the next thing and the next thing. So there is this balance between trying to be about being specific and being aspirational, and some call it incremental. I might call it sequential, where it's a step toward another effort. And that is the balance that, and I mean, I don't want to happy talk this. This is a real tension. This is there are obviously in the health reform space folks who want to get to universal single payer and want to do it yesterday. And I share that view. I also know that a lot of the fights I've waged in the last 20 years have been about trying to prevent a budget cut to already won victories. And there's a satisfaction in preventing a cut. There's a satisfaction in helping somebody not get a surprise medical bill or something. But obviously, you want to put it in the context of where you want to eventually go. And it's a tough tension, but it's one that we have to navigate about what's the right way to both talk about it and frankly also believe in it, to inspire yourself as well as your colleagues.
Yeah, I love that, as sequential instead of incremental. I'm going to use that for sure. Patty, I'll come to you next.
Yeah, definitely. I would say to build off of that, you also are moving at the speed of trust. And so the trust sort of building, it cannot be understated. I think it should be underscored. It's incredibly important to the vision. I would say that when I am a pretty impatient leader and have been, and learned a few lessons along the way. And, I didn't want to wait for the sequential steps on a particular policy we were pursuing with young people. And I went rogue. I didn't listen to my funder. I just did it because I knew it was an opportunity. And I got a champion to say, yes, this makes sense to me. And I then got pulled into a meeting with my funder who was like, you weren't supposed to do that. And you needed to have waited for us. So you got to know when to go rogue, and you got to also know when not to go rogue, because it doesn't help advance your work. And I learned a lot of lessons in that process, and also learned that it wasn't about me, that it was actually about the larger community and getting that larger win. I also think every step is a win. It is not only in the long-term work that you're trying to achieve, particularly as we work with young people across the state. The fact that they show up is a win, the fact that they believe that their lived experience matters and that they are facing inequities and they do have solutions to change. The fact that they can build across coalitions, the fact that many unlikely partners can come to the table to create change with you and alongside you. I think that's incredibly important to think about. And for me, we have to study what works and doesn't work over time. With young people, and be able to prepare like that Cadillac set of asks, which we always show up with 12 things. We want these 12 things so that you can say no to most, but you can't say no to all of them. We will walk out with a win. And how do we prepare for that type of policy change? So I'll add that.
Wonderful. And Tracy, I'll come to you last before we answer some of our audience questions.
Yeah, those were great remarks, and I definitely feel that, like, getting out and like, because to me it seems so obvious what should be done, and it's very, I'm just going to talk about TSCA. That's a little bit like, because that also happened during the Obama administration. It's a little bit like the Affordable Care Act. It's like something happened, but it didn't meet all the goals that we wanted, and to me that was extremely disappointing. In this space, you want, like what they have in Europe, if you have a chemical that you're using on the market, you should have data for it so you can know whether it's going to be toxic or not to people who are putting it on their body or whatever. So, and that's not the way the law is set up. There's some good things in the law. So working with what, over the long game, and realizing that, yeah, you're going to have, not everything is going to be 100%, but I think you have to recognize who's your adversaries in this situation. And for us, the adversaries are a lot, and it's not, we have a commonality, and our adversaries are pretty well organized in terms of, corporate interests that are trying to preserve a status quo for profits. And we have been thinking a lot. We continue to work on the environmental health, and also, bringing in climate change, because there's shared focus on, like, for example, the fossil fuel industry is a contributor to the chemicals that we're exposed to, as well as the climate change, obviously, crisis that we're in. And so one thing that we've been thinking about is we have to work on the incremental or the sequential focus and continue to build on the gains that we make. While also, one of our things that we've been thinking about was, how do we think about other strategies to reveal this influence of these negative actors that I think we haven't done a very good job of talking about and working together on, to reduce the influence of these corporate influences on. It's a shared thing that makes it difficult for us to do the work to protect the public's health. So I would say, and so I think it's really important to celebrate the successes that you have, because they're very hard earned. And one thing that we contributed on the research side, which I know research is very slow, but was eventually the state of California did ban these flame retardant chemicals that are used in furniture. And it took, 20 years, but it took a lot of coalition building between advocates, public health officials, scientists, and really revealing the role of the tobacco industry in promoting these chemicals to further their products. So I think, learning from that and carrying that forward is really important.
Thank you all so much. I know we have just a few minutes left, and I want to make sure there's a couple questions from the audience. So the first one I'm going to pose to Patty first, and then others can feel free to jump in. So this question, it says, I'm working with community advisors on a study who feel that they've been, quote, fighting this fight, in this case, trying to reduce racism and inequities in medicine for years, and nothing has come of it. Their patience for research is increasingly limited. any wisdom for how to productively address community members' very reasonable concerns about whether research is the right place to invest their energies?
Oh, that's a good one. Thank you for asking this really important question. I think you have to have multiple strategies to create change. Research is one vehicle to create change, but I think that given the sort of times that we're living in, if you're thinking about how do we reduce racism and inequities in medicine, like we actually have to change the narrative and actually get that narrative out and exposed. This is a great opportunity to guide folks to thinking about how do you use media and media advocacy as a lever for change. How do you tell this story in a way that feels palpable and understood by others, to be able to put some pressure on things to change within medicine. That's not my area of expertise. I'm not a content expert there, but I am an expert at putting pressure in the right places in order to create change. And if folks are feeling tired, sometimes about taking a step back and bringing others to the fold and thinking through those strategies. So I would say like getting those folks with organizers in a room to cut that issue multiple ways and figure out how do we tell this. We have to change the narrative. We have to build some coalition and some partnership on this. Is there other things within medicine that is happening that we can model here or connect or link in some way? I guess that would be my response. And like, you also need to know when to step away to preserve your own health as a leader, particularly as a leader of color. I know that I've had to do that. And that's important. You sort of have to take that time for yourself, because we can continue to live in this white dominant culture, right? That continue to tell us that we have to do, we have to produce, and it just doesn't serve communities of color in the long term.
Mm-hmm. Wonderful. Thank you, Patty. Anything, Tracy or Anthony, that you want to add to that?
I think it may also be that different folks have different roles, right? Like there's folks who are drawn to the research, to the evidence base, to the process, to the discipline of it. And there's others where there's other roles, as advocates, as organizers, as communicators, as whatever. There's other places in the world. So like necessarily, maybe for some of those folks, their skill set may be better adapted to other parts of this spectrum of work that can be done. And then I'll also just say that I also do underline the need for trying to figure out like victories that help both end up providing a meaningful improvement in somebody's life, and that shows that you're moving along to the next step. Because if the question is solving racism, or even solving racism within the medical field, that's a big topic. But if you can break it down and say, well, what can we do about Black infant mortality? What can we do about the issue of people not being able to talk to their provider because of a language barrier? What can we do about something? Those are some specific things that we can grab onto, that there are solutions for, and we need research to help illuminate the path of what the problem is, and importantly also what the solution is.
Mm-hmm. Yeah, I would just want to add, those are great. And it's just really important to work also. I mean, it's true, health inequities have not changed. And that is something that continues to flummox our everything about how our work that we're doing. I think for me, it's we try and work with other not like-minded, but people who are working together on this, so you don't feel like you're isolated, because it does feel this challenge. I mean, Black infant mortality, I don't think it's budged since they've been recording the data. So it's obviously there's still more long-term work to do on this. But I also agree that figuring out the very small or the thing that changes slightly the system, like, the Affordable Care Act is one way for coverage, but then, Medicaid expansion or whatever. For us, it's all about chemical exposures and illuminating environmental injustice. And it's, there's been some progress made on that. And so that's where we focus our energies in this issue.
Mhm. Such rich answers. I obviously wish we had even more time, but I know we're drawing to a close. And so I want to really thank our three incredible panelists. I know I've learned a ton from this. It's left me feeling inspired after, election day to keep going. Obviously, these things can take a long time, and sometimes they're unpredictable. And there are times when you think things are going to go worse than you expect, and times when they go better than you expect. I want to, in our last 2 minutes, maybe just real quick, come to each of our panelists and see any last words of wisdom you have for folks in terms of building that long game, or when you feel like you've gotten a whole lot of no's. I know Patty and I had a conversation about preparing for the no, but when you feel like you've gotten a whole lot of no's, maybe just one thing you do in those moments to sort of get back up. And maybe that involves taking some rest, as Patty said, but really whatever you find helpful in those moments. So maybe I'll come to Anthony first.
I think this year we had a couple of big wins with expanding Medi-Cal to all regardless of immigration status and creating a new Office of Healthcare Affordability. But we did have a major bill on consolidation die. We did have a bill on healthcare consolidation, having oversight over it. And my belief that I tell myself is that if you keep working on it, you're never defeated, only delayed. That we're going to work on it next year, and we're going to work on Covered California affordability on cost sharing. Another thing we didn't get done this year, and it's just that it's not that we lost; it's just that it got delayed. So delayed, not defeated.
Love it. I will keep that in mind for myself too. Tracy, I'll come to you next.
I was thinking I will take a nap. That was my answer.
Perfect.
I totally agree with Patty. If you need to take a break, you should take a break, because we work hard and we have really big problems we're taking on. So sometimes, anyway, it's good to have a hobby.
That's perfect.
So, yeah. And I just would say, you really, to me, going and being in, and it's been a pain with COVID, going to in person and talking with people outside of our, that are working in this issue together, that are your colleagues and friends. It's really important.
Yeah. And then last word to you, Patty.
Yeah, sure. I would just say, as folks that live in a binary world, we either win or we lose. And as a non-binary person, I think you have to make space for both the loss and the win along the way, and sort of see a world where both can be true, both can live in the same space, and we can take something away from that. So I think for me, just trying to expand that thinking and really sit with that is really important. And taking a nap and having some fun, also totally soothes the soul.
Wonderful. Thank you all so much. This was fantastic. I know everyone who's here benefited from it, and then there will be many more folks within UCSF and beyond maybe who will see the recording and benefit from it. I know I'm going to take the advice to go take a nap, and also to reach out to colleagues and friends in person to sustain ourselves. And that, of course, we're never defeated, we're only delayed. So thank you all so much. Really appreciate your time and your work.
Thank you so much. Take care.
Thanks.